starts, I'll give a little introduction, and then you may begin your presentation.
All right.
Awesome. Thank you, Tiffany.
We're live now.
Okay, welcome back everyone, and welcome to another session of Pre-Dental Universe. I'm Tiffany, one of the pre-dental students monitoring today's session. We have an exciting presentation today with Dr. Almasri. And before we begin, we just want to thank the doctor for sharing your experience and some of your professional insights with us. And on that note, feel free to take it away whenever you're ready.
All right. Thank you very much, Tiffany. And I appreciate you all picking me out on Instagram. I started the Instagram journey probably about 4 or 5 months ago, and just wanted to share some tips and tricks with my colleagues. And I feel like Instagram has been like more of a lounge where all the dental people go in and hang out and have a drink and chit chat about life and chit chat about teeth. And I've been enjoying it. And that's how I met Sherry. Sherry reached out to me, and I appreciate you reaching out to me and making this happen. And I do apologize for making everybody wait. It's not in my intention. Dentistry happens, and I got stuck in the operatory for an extra half an hour that I did not expect. So the presentation that I prepared is for, I understood from Sherry, all of our attendees are dental students. And dental students, to talk to them about immediate full arch loading concept, it's a little bit can be overwhelming. So I try to simplify it as much as I can. And I hope it's simple enough. It's a very common procedure nowadays. And everybody heard of like all these dental implant centers and how you can get your smile in a day. And that's why I wanted to share with the dental students, how can smile in a day happen? How can teeth replacement happen in one day? It's a simple concept. It's been around for years. And I'm going to tell you a little bit about myself real quick. I started my dental journey as a dental assistant. Then I worked as a dental technician. Then I went to general dentistry, didn't do it for me. And once I wasn't a general dentist, I did oral surgery honor class in dental school, where I performed a lot of surgery as a dental student, which is fantastic. Then I picked up prosthodontics program where it was heavily surgically involved. So we did all of our surgeries as our prosthodontists. And after I graduated as a prosthodontist, I did anesthesia training to be able to offer that for my patients whenever we do these big surgeries. As Sherry called me, the zygoma expert. When you do zygomatic implants, you do need to put patients at ease, and you can't do it away. With that said, I'll tell you about my professional career now. I started at Fast and Small Dental Implant Centers, and I also have one-on-one implantology. I do private tutoring for doctors, or training, as you say it, who wants to do more with dental implants. And I'm a part of the 4M Institute. I'm on their advisory board, and I do co-chair. And I do surgery. On top of that, I do surgery in the office mainly, and I do some prosthodontics as well. And I teach at Nova, and I know majority of you are from Florida. So, hey, awesome. That's my favorite place on earth. I love Fort Lauderdale. I went to NSU for school. Originally, I'm from Damascus, Syria. My grandpa is Egyptian. That's why I get the last name. They moved to Damascus. I lived in Aleppo for quite some time in Syria. Then I moved to Dallas, and then I ended up in Florida. And I went back to Dallas. So I live in Dallas. I live and reside in Dallas. So today we're going to go briefly about the concept. How can we do teeth in a day? How can we do the all-in-4? How is it possible? What's the advantage? What patients qualify, what don't, and some of the complications. And I'm going to try to make it as easy as I can. Majority of the students probably second, third, fourth year. I don't know how many of you are in the last year of dental school, but if you are, this can be very helpful if you decided you wanted to do a little bit more with your career than just general dentistry. If you want to become a prosthodontist, or oral surgeon, or somebody that can be involved in these kind of cases. It's amazing what you can do and how you can change your patient's lives. So the concept relies on tilting the posterior implants to get more anchorage and better bone, and then to avoid the sinuses and to avoid the mental frame. So with that said, when you tilt them, you engage better bone, so you get better stability, you get strong implants on day of placement. And you can correct that tilt using a special abutment called either many conical abutment, multi abutments. These abutments can correct up to 17, 30. I use sometimes 45-degree correction, and they are in the process of getting an FDA approved 60-degree correction of angulation of a multi-unit abutment. It's made by Neodent, and that's the company that we use in the office. So tilted implants, I spoke about that, and I get asked about a lot by patients, or by dental students, or by some of the doctors that I train. Like, really, all you're going to do is put 4 implants, and you're going to put a bridge that goes all the way across. Yes, it is enough, and it was proven by literature, by research. It's supported by peer-reviewed articles and publications that 4 is plenty. 4 is more than enough for and I say that, but in some cases, you have to put 5. In some cases, you have to do zygomatic. In some cases, you have to do pterygoid implants. So it's not a cookbook, and I tell everybody, if it's a cookbook, I would have wrote it a few years ago, and I would have retired, because I'm going to be filthy rich, because everybody's going to be buying it. And I don't have to do dentistry anymore. But it's not a cookbook. Again, the tilted concept make you able to avoid the sinuses, so you avoid bone grafting, you avoid vital structures as the mental foramen. You tilt those implants, spread them out. You get a good anterior posterior spread, so you can deliver a prosthesis that is fixed on day of surgery. If I'm going too fast, Sherry or Tiffany, please wave at me. If I'm going too fast, I hope I'm not going too fast for you.
No, okay. Oh, no, you're going at a good pace. Thank you.
Okay. Fantastic. All right, so criteria for immediate loading. So whenever you want to load the implants on the day of surgery to give patients same-day teeth, what do you need? You need a few things, and the most important is to have at least 4 implants. They have to be good distribution around the implants, and they need to be very stable on the day of surgery. What we call it primary stability. It has to have a number with a torque value that goes between 30 to 50. Some people say 35. I say 30. If it's 30, I'm going to load it. And that's the amount of torque value of the implant on the day of surgery. It's called Newton centimeter. And some of you might be familiar with this. Some of you might not. But that's the torque value on the insertion of the implant on the day of placement, on the day of surgery. And they have to be all splinted, and you have to have good occlusion. You have to establish good occlusion. Now they say that there's a lot of mixed feelings about loading an implant on the day of surgery. Like, oh, is that going to ruin the bone? Is it going to move? Actually, there's research shows that there's bone implant contact more on the immediately loaded implants rather than on one delayed, and it's almost double. So you get double the amount of bone implant contact on immediate loading. So I think the stimulation of the bone by having an implant inserted in function right away enhances the osseointegration, which is the process of the bone adhering to the implant surface. Success rate has been proven that it's been very, very extremely high with implants, and as I said, the tilted implant concept is not something that we came up with. This is something that's been used for years and years. Whenever I say years, it's like 20 years almost. People have been doing the immediate loading with the 4 implants and the days of Branamark. Now, let's go over, is 4 enough? As I said, if 4 implants are all good and strong. Sorry, let me turn off my phone. Of course, that's going to happen because I ran from the operatory straight to my laptop. So if we had 4 strong implants, good occlusion, good bone, everything's good, 4 is enough. But in some cases, 4 is not enough, as I said. What's the main advantage of this concept? Is that you're not putting your patients in dentures on day of surgery, which is a huge plus. Just picture that your patient's going to walk out on surgery day with a permanent bridge instead of having dentures after you put the implants and let them heal. Now, Sherry, which year of dental school are you? You second, third, first?
we're actually pre-dent, so we're still
Oh, it's
undergrad.
pre-dent. Okay, so it's still pre-dent. Okay, so
Yes.
this is this is way advanced. So I'm gonna
Yes,
try to
but we
to.
might have dental students too, so we have an
That's what
audience
I
of
saw. I saw in the group on Instagram. There is some dentists and some dental students. So
right.
I'm gonna try to simplify this, okay, as much as I can.
Okay. Thank you.
Um, so when you give your patients, usually what happens is you give your patients dentures on day of surgery, right? Because that's the most common thing. They take out the teeth, put dentures. But in our case, in our practice, what we do, there's no dentures. So we put the implants in, we load them right away, okay? And and then we take patients from morning to afternoon with results like this, which is fantastic. And those teeth are permanent. So what I'm gonna do is I'm gonna start to use less of the dental terms, Sherry, and more of a like less dental terms. And I probably this way people will be more comfortable with the language spoken because this is
Absolutely.
the different language when you speak dental, and then make people a little bit more comfortable and knowing what we're doing. So you can literally take the patient from that morning to that afternoon using dental implants, which other doctors probably told them, no, you're gonna have to wear dentures for years. You're gonna have to have bone graft. We're gonna have to do multiple procedures. No, not in our case. We take the teeth out, clean up the bone, clean up the gums, clean up everything, remove the infection, and then put implants in and load them on the same day. So patients will walk out with permanent teeth. And literally, whenever I say morning and afternoon, literally that's morning and afternoon. Those are the teeth that they walk in the morning. Those are the teeth that they walk in the afternoon. So what we do truly transforms patients' life, and it just take them from not being themselves, from not living life, or from not being able, like a lot of patients come to our office and their hand is over their mouth and that's how they're talking, and you can hardly ever understand what they're talking about because they're mumbling and they're hiding their teeth. So when you transfer them to that, you see them at 1 week post-op, makeup, hair done, nails done, even like the like get all dressed up nice and fancy because they have something to brag about. They have a pretty smile, and it starts with the mouth. It starts with a smile. And you see that guys, they'll let their beard go and their hair is a mess. Start like cleaning them up themselves a little bit, shave their beards, clean their hair, go get a haircut because now they feel good about themselves because it starts with the teeth. It starts with a smile. And you're in for a treat if you go in dentistry and you specialize and you do something like this. Not as only is it profitable, forget about the profit, forget about that this is a good paying job, but it's amazing how you can touch people's lives and how you can change them and make them feel really good about themselves. So, so this is the bridge, and this is how it looks like. And this is what you call the anterior posterior spread. So when you tell those implants and you spread them out, 4 is enough because that will be able to support the whole bridge, if that makes any sense. Um, the picture on the left is what we do, and the picture on the right is what they used to do in the past. So in the past, they used to use that metal and acrylic, and it just used to be really ugly, and they didn't really spread out the implants that much. And then we took it from there. We start tilting the implants, and then put them in an angle to get them more spread out, and then give them better teeth. And what we use for final, we make zirconia teeth. So the teeth that we make for the final is zirconia. Zirconia doesn't break. You can probably see one of my videos on Instagram. I ran over the teeth with a car. I tried my beamer. I ran over it with a beamer. Didn't break it. Then I got my wife's GMC XL because we have what we call it the mama's bus. You all familiar with the GMC big
Yeah.
mama's bus? Okay, so we ran over the teeth with that, did not break it. Then I took a tractor. We have a ranch out in the country, and I have a tractor. Yes, I do drive tractors. And people say, like, what? You're a doctor. You don't drive tractors. No, I do drive tractors for fun. So I grabbed the tractor, and we ran over the teeth and didn't break them. So zirconia is a pretty amazing material for these full arch restorations because it really, when you tell the patients, you're going to have teeth for life, then you really mean it, if that makes sense. And when we select the cases, there's a lot of work that needs to be done. It's not, oh yeah, you are a candidate, come on in. So you have to do a consultation. You have to know what the patient's expectations, what do they want. You take some measurements, models, pictures, and such things. And that's whenever you start talking about them from a psychological standpoint. You want to see if these patients' expectations can be met, because some of those patients that they're like exacting or hysterical or indifferent, their expectations are way high and you probably can't meet it. So not only that you need to look at them in the mouth and see that they qualify from a mouth perspective, you also need to look at them from a psychological standpoint. And then don't touch those patients. If you decided to be dentists, don't touch anybody with BDD. Yes, it does exist. It's a disorder called body dysmorphic disorder. What it is, it's 1 out of 50 people that found out that they have it. So no matter what they do, no matter how much you tell them they look gorgeous, they look handsome, they look pretty, their lips are great, their eyes are beautiful, the teeth are gorgeous, they're not going to believe it, and they're going to keep looking at themselves in a mirror, and it's going to interfere with their lifestyle. So if you see any signs of these patients, I try to send them to the guy down the street that I don't like, and I tell him, I know a perfect guy for you. So I send him to the guy that I don't like to treat him, so they become his or her problem, right? So because some patients, you just can't meet their expectations. It's just hard. And dental implants in smokers or diabetics or patients with have bone disease, or if they're young, below 18, or have some immunosuppressant diseases, you really don't want to treat them with implants before you consult with their physicians, because it's an implant. It's a foreign body that you're inserting in the bone, right? So you need to make sure that the bone is going to heal and the patient's going to heal with that. These are some of the example cases that patients we've done. And when you look at them, you say, wow, where do I start with, right? Like it's looking at this old beat up house, and you look at it and you want to remodel it. And you're like, where do I start with this? Like there's so many places that I need to start with. And those are the patients that do qualify for just total reconstruction. Say, tear that house down, go to the ground level, and then build everything from scratch. So these are the results that you're going to take your patients from within a day. And yeah, like within a day could be misleading. Say patients, so like I go for my consultation, I walk out with teeth. No. There's a little preparation. So what we need to do is we need to take pictures, do measurements on one appointment, go over your medical history, make sure that you qualify, make sure everything is good, and then we'll bring you for the 1-day treatment, if that makes sense. Because the 1-day treatment stands for coming in the morning, put to sleep, wake up, surgery done, and now we're going to start making your teeth. And that's whenever the teeth making starts. And then they leave with that permanent bridge on the same day. So I hope I'm getting people pumped up here and say, oh, I want to be a dentist for sure now. You know, this is awesome. All right. So number of implants, I'm not going to go into details in this. Now, problems. Yeah, problems happen. Problems happens with anything that you do in dentistry. Some patients are going to break their teeth. And that's the temporary. That's what we call the hybrid. This is the first set that they're going to get on day of surgery is made out of acrylic material, because zirconia takes few days to make. So we give them a set. They get 2 sets. The set of surgery day is acrylic, and it might break, chip. We tell them that. You tell them that those are this guy like eats Doritos, which is, I love Doritos. Who doesn't like Doritos, right? And this guy goes and eat Doritos on acrylic teeth, and he comes back breaking his teeth and say, no, I told you no crunchy food on the first set, because they're going to get a first set that is temporary, and they're going to come back for the second set, which is zirconia. So you do have issues with the first set where they can break their teeth, something like this. If you don't properly design it or do something crazy, they can really split those bridges in half almost. I want to show you something really cool here. I'm not going to go into the trauma, but like this guy. He's a severe grinder. He's a bruxer, and I probably bet you anything, half of you watching me out there grind your teeth. I see some people on my Zooming. Only 3 of you. Anybody grind your teeth?
I do. Unfortunately.
I don't.
Everybody grind their teeth almost, I feel. Stress level, right? All these cell phones, all this social media, trying to keep up with everything. It makes you grind your teeth and pull your hair out. No, we don't want to pull the hair out. We keep the hair. Anyways, so this guy is a severe bruxer, put him zirconia. He didn't break his teeth with grinding and bruxing, right? He broke his teeth in a car accident, and the teeth did not break. So this is the zirconia. So zirconia, as I said, doesn't break. But what happened is he broke the screws that attaches the zirconia to the implant. So it was a simple fix. We just took the screws out, put new screws in, and put the zirconia back in, which is pretty awesome. So your teeth will not break, not even in a car wreck, right? Who wouldn't want that? This is a good surgery case. I'll explain to you the process. So this is how the patient presents. And I hope y'all don't change your mind about becoming a dentist once you see this picture. It's not always like this. This is extreme. This is really extreme. But it's a great case because it turned out pretty awesome. So this guy doesn't brush, doesn't clean, doesn't do any oral hygiene, doesn't care, because he just hates his teeth. And he has the mindset, I'm going to take them out and put dentures in. So what we do is we do the workup, we do the diagnostics, we make teeth in advance. And the teeth look like dentures, right? But they are not denture. And this is what we take out on day of surgery. Those are his teeth. Again, I hope you don't change your mind. Because it's not always like this. So, and that's we flap everything open, we open the gums, we clean the bone, we clean everything, make sure everything nice and spotless. I see Hannah's face is going like, oh gosh. But with that said, it's awesome once you do the first surgery. It's really amazing. It's a good feeling, and especially what you could do for these patients. So once we took the teeth out, cleaned the bone, put the implants in, we use special tools called surgical guides and abutments to know exactly where we're going with the implants. We use some bone grafting, we patch up the holes where we did, then we suture. And everything should look like this on the right side in the center. Sutured, nice and pretty, everything is spotless. And then after that, see that? That's mouth, after we got rid of all the diseased teeth, everything nice and pretty. Closed everything up, sutured, and after we did this, now it's time for making the teeth. That's whenever the patient wakes up. And that's whenever we start smiling. Okay, the ugly parts are over, and we're gonna get to the pretty parts, right? So now we make them measurements, and after we make the measurements, we send them to the lab. And then the lab will pour up these measurements, and we'll make teeth. And these are the teeth that they made off of the models. And so the teeth were made on the same day, and then they're delivered. What a huge change, huh? Like, it's tremendous. It's amazing. Like, taking somebody from this to this on the same day is pretty awesome. And then that's what we do. If you look what this guy said, I love him. I love this patient. He grabs his steak, puts it next to the grill. I think he has a margarita or what kind of drink it is. He didn't invite me. He just sent me a picture. Says, thank you for my new life. More to come. And it was a text message. And I love it. I love receiving those text messages from patients after we do what we do for them. Because this guy texts me like 3 months later after surgery. Now he can eat a steak. Now he's not ashamed of his teeth. Now he's smiling pretty big to the camera and taking a picture. And I put an arrow to show you that big juicy steak. It looks pretty delicious. But this is what we do. This is Fast New Smile. This is one of my very first patients. She was about 38 in that picture. But look how and this is not photoshopped, I promise you. But look how she shines. Like, she really, truly shines from the inside out with the new teeth. She smiles bigger. Her eyes are bigger. Everything. She's more expressive. She's more shy on the right side. She didn't want to smile. She goes to the right side with that after picture. She really, truly smiling big. From her heart, smiling really, really big. So, and people say, oh, you change lives. I said, no, we're not changing lives. They already have a life. They lost it at one point in time. We're just giving it back to them. Because now they are back to who they are before they start having teeth and issue problems. This is my wife on the left side. Her name is Amanda. I couldn't do what I do without her support. She's a great support. And those are my kids. Layla on the left, Jax in the middle, and Savannah June on the right. They're good kids. Layla's 8. Jax is almost 4. Savannah's 6. Jax will be turning 4 in March. He's a daredevil. The girls are sweet. Boys are sour. That's what I always hear, and it's a living proof. One of our favorite sports is to surf. We're big surfers family. Even Jax, my 3-year-old. This picture was last summer. Of course, not during February in Dallas. We don't surf. But this was last summer. He just turned 3 years old, and he wants to surf with Daddy. And me and my wife, sometimes we get up and try to do some stunts. And then Savannah, 6 years old, turned 6 years old, start surfing. And Layla, she was 7 here in this picture, and she mastered it. She's a pretty good. I think they're gonna go into competitions at one point in time. I want to thank you guys. Thank you, Sherry, very much for finding me and reaching out. And I hope this presentation gave a little bit more motivation to everybody who watched it and wants to be a dentist and wants to be in the dental field. It's such a rewarding field to be in. Even if you just do cosmetic dentistry and you do veneers or you do crowns, I mean, you're still doing too much for people who have very low self-esteem or not feeling confident, and you can really change people's lives in our profession. It's pretty amazing. Even braces don't work as fast. I have a good friend of mine. He's an orthodontist, and I tell him I do what you do in a day. Just because braces take years to straighten them up, make them all nice and pretty. I always tease him like this. Again, thank you very much for having me. I appreciate you very much.
Thank you so much, Dr. Almasri. We had an amazing presentation with you today, and it was very insightful of how, you're honestly one of the best, speakers we've had here with, their work. It's the smile looks very natural and not, bulky and all those things, so it's
Thank you very much. Very well appreciated. Yes, I love that. Thank you.
Yes, of course. If you don't mind, we have a couple questions in the chat. Maybe we can take 15 minutes or so answering some questions.
Absolutely, bring it on. Yeah, that's what I'm here for.
Okay, perfect.
Right? You booked me for an hour, you got me for an hour, so use me while you can.
Thank you so much.
Yeah, go ahead.
Okay, so the first question that we have is, someone's asking, can you talk more about your dental journey and how you got into implants and prosthetics?
Oh, yes, absolutely. My dental journey. So, my name is Riad Almasri, right? My uncle is Riad Almasri, and he's a dentist. So, as a kid, I grew up knowing my uncle, because I was named after him, and he was the dentist. And so I hang out with him quite a lot. I'd go to his practice. Then my older sister got married to a dentist. Then, I feel like I was surrounded by dentists so much, and I've always liked to do things with my hands. I was like that kid that took the cars apart and put them back together and destroyed everything in the house and still fixed it, because I like doing things with my hands. So, and I wanted to be a doctor, and dentistry just sounded awesome just because I was surrounded by a couple of dentists, so I decided to become a dentist. Throughout my journey, as I said, I worked as a dental assistant and dental technician, and I really gained quite a lot of experience by just doing that. And I highly recommend for all of you guys who are out there and they're trying to become dentists, go work for a dentist, even if they pay you $1 an hour. I'm kidding, nobody pays $1 an hour. It's below minimum wage. But go work, go see it for yourself. If you have a family member in a dentist, go work in the lab. Just see how things gonna be if you want to do this. This is my biggest advice. Just get up. If you go wine tasting and they give you a little sip of wine before you and then you taste it and you're like, oh, I don't like this. Give me another kind. Same thing. You need to shadow maybe an orthodontist while you're in dental school, a prosthodontist, an oral surgeon. You need to know where your passion is at. But anyways, I found my passion in dentistry. That's how it began. So after I became a dentist, it was just not doing it for me. What does that mean? I felt like I could do more. And I'll go back to what my wife says. She says, "You always want to do more. You've always like if there's a plan in your head, and there's another one preceding that, because once that's accomplished, you want to find something else, and that's was my goal. Like, okay, you know what? I finished dentistry. I became a general dentist. Okay, what's more? I wanted more, so I started exploring prosthodontics, just because simply prosthodontics, you need to use your hands. You have to be good with your hands in the prosthodontic, because it's all the prosthetics and making teeth, and you have to be an artist um, uh, at some point to become a prosthodontist, because it's art. And like it goes back to what Sherry said, and I appreciate your comment, Sherry. The teeth that you showed, they look very natural. They're gorgeous teeth. They're beautiful, like one of the best I've seen. And I appreciate that. But that goes back to art. You have to find that artsy heart in you for you to be able to do the cosmetic dentistry, which I call it plastic surgery. That's what we do, is plastic surgery in the mouth. And so I decided to become a prosthodontist, just because I like that, and I like to do surgery, because during my dental school I did a lot of surgery. I was like I think like the only student in the whole class that did like 100 plus extractions in one semester, and they thought I was a beast. But to me, it was just fun. Like, I enjoyed doing the surgery. So I wanted something to combine surgery and prosthetics. So prosthodontics, which was my specialty, was the perfect combination for these two. And that's how I decided to become a prosthodontist. And that's what I do every day, all day long. I hope that answered the question.
Thank you, Dr. Almasri.
Absolutely, yes.
So the next question is, how do you develop your treatment plan when working with patients, and what factors do you consider when deciding what to do next?
Okay, let's repeat that question. Okay, first question is, how do you come up with a treatment plan?
Yeah, when working with your patients. And then the second part of the question is, what factors do you take in to decide what to do next?
Okay, so this is a question that can go for a weekend course, like literally. And I'm serious, I'm not joking, you're all like laughing. It's a weekend course, so there's a lot of factors. What we do, what makes it easy in our office, is that we're very specialized in what we do, which is the one-day dental implants. So the first thing that you want to do, I'll try to make it short, okay? Patient come in, we do a 3D CBCT scan, okay? So it's this three-dimensional X-ray. We look at their bone, and we see if they qualify, right? Now, after we looked at the bone, if they qualify for what we do, now if they need a crown filling, braces, gum treatment, we send them to whoever does that, because we don't do that, right? But people, when they come to us, they want a fast, new smile, because that's our name, correct? So it makes it very unique. So to answer that question, you probably want to ask a general dentist, like, how do you come up with treatment plans? And our treatment plan is, do you qualify for what we do or you don't? Some patients come to us and they're like 18 years old and they need braces. It's, I want to remove them all and put implants. No, go to an orthodontist. You're too young. So I'm just giving you an example. But what we do is highly specialized, and then people come for exactly what our name is for. Like we could do single implants. For example, patients come in and they lost a front tooth. So what we do is we put an implant in, we put a tooth right away. So it's also called the fast new smile, but we call it the mini. So I hope that answered the question. So CT scan, see if they're candidates for what we do, and if they are, we'll proceed with like medical history, pictures, images, get all of that to the lab, get the impressions to the lab, and the lab to make the teeth and bring it for surgery day. And it's easy. When people say like easy, like how is it easy? Like, it looks so complicated. But when you do something every day, all day, it becomes like waking up, drinking a cup of coffee, going for a walk with the dog, and come back home.
Thank you, Dr. Almasri. Okay.
You're welcome.
So the next question that we have is, are there any techniques that you use when dealing with uncooperative patients or patients with mental illness, like you mentioned, BDD, body dysmorphia?
I don't treat those patients. I said, as I said, I do not. I refuse because their expectations are so high. I just, if I get that vibe from a patient that they're gonna be trouble, and I mean, sometimes you unfortunately you can't screen them all, right? But you get that patient that is like very demanding, like during the consultation, constantly looking at their phone and fixing their hair, fixing their eyelashes, or fixing their nose or lipstick, or not paying attention to the conversation that you're having. You're like, I'm sorry, but I can't treat you. You don't qualify. Why? I know somebody who can treat you better. As I said, I'll send him to the guy next door. I send him to the competition. Yeah. But and then you're gonna have those patients. You're gonna have those patients that they're really high maintenance, and you just have to treat. Let me give you an advice. This will give you a good answer to your question. Treat everybody like they are your mom, dad, brother, sister. Okay, and that will solve all of your issues. So if you treat every person that sits in your chair and they trust you with their life and their teeth like a family member, you'll never get in trouble. And everybody will love you. That's what you want. Make more friends.
Thank you, Dr. Almasri. That's a good advice. So the next question is, what can you do to make yourself more competitive for residency programs during dental school? Like, what did you do specifically, and do you have any advice in regards to that?
Awesome, fantastic question. I love it. So, whenever I applied for residency programs, I had a PowerPoint presentation of everything that I've done in my dental journey. Like I documented pictures of my lab work whenever I was a lab technician. I documented everything that I've done throughout my dental assisting. They want people that are excellent in residency program. They want people with experience. They don't want to get somebody that doesn't have the motivation. You need to show them that you're motivated and you want it to do, and make yourself different from everybody else. So I documented everything that I've done in my career, and that helped a lot. Because I mean, if you go apply to a residency program and you were working in the dental field before you become a dentist, so that's what they want. They want somebody that's well-rounded, have seen it all, have done it all, and then want to learn more. So pictures document everything that you do. And let's say you don't do something related to dentistry. Let's say you do some internship with a cardiologist. Mention that, because medical history is significant in what we do as a prosthodontist. You need to know a little bit about cardiology. You need to know endocrinology. You need to know gastroenterology. I mean, you don't need to be a cardiologist, but the more knowledge that you have, the better you are for the program. If that makes sense, you need to be very knowledgeable, and you need to present something way, let's put it this way too cool.
Thank you, Dr.
Absolutely.
Okay, so someone's asking kind of like a fun question. How do you balance your work and your family life?
That's really hard. That is really hard. So I'll tell you this. I wake up early morning. I have 7 hours of sleep. So I'm a gym nut. Like I'm in a gym, like 5 to 6. Then I'm with the kids, making them their milk and stuff in the morning, their favorite drinks, from 6 to 6:45. I'm in the office by 7. So I do spend some time with the kids in the morning. And then whenever I work really hard Monday through Thursday. And I try to be home every night for dinner. It is hard, but I try to make it happen. But if I don't, they understand, because Daddy will be home on Friday, because we don't work Fridays. So that's the beauty about being a dentist, right? You can work hard 4 days, but I'm off Friday, Saturday, Sunday. So in these days is when fun begun and kids time and family time, and you need to make sure that life doesn't consume you in what you do, because it could possibly very be easily consuming, and you need to find the right people to work with that they can help and be a part of a team that can provide this care without everything being on top of your head. And then, sometimes I work a little harder, like if I have like something that I need to get done in a timely manner, but I still want to go to my kid's soccer game, I want to go to the basketball game, I want to do this. So I stay up at night after they go to sleep and I get that presentation ready. Or I wake up earlier before they do and I do this. So I try to find that balance, and still, as I said, I get my 7 hours of sleep, and this is very important. This is an advice from me to you. Just get your beauty sleep, so you'll always be beautiful or handsome. And it's good for your brain health too, sleep. Yeah. I hope that answered it. Yeah.
Yes, it did. Thank you.
Yes, good.
So the next question is, how did you build your dexterity skills? I know that you said you previously worked in a dental profession before actually becoming a dentist and going to dental school, but did you have any other things that you did to build your skills?
So it comes with experience, as like you said. I worked with a great dentist. His name is Lauren Berlin. I'll give him the credit. Whenever I was a dental assistant, and he taught me a lot. He was like one of the greatest guys in cosmetic dentistry in Dallas. And I worked with him as dental assistant. He taught me a lot. He taught me at the lab. He taught me this and that. So, and that's how I got my experience. I got a lot of my experience with him, and I got a lot of experience with working as a dental technician in one of the labs here in Dallas too. Studying, working, reading. You can't read enough. I can't emphasize enough on reading and shadowing and being involved in the things that is related to what you want to do in your future.
Thank you, doctor. That was great advice. So, speaking of advice, someone's asking, what's one piece of advice you would give to a future dentist that you wish someone would have given to you?
Aim for 100% and accept 95. Always aim for 100% and accept 95. You're not gonna be perfect, but if you go get close to perfection, do it. Okay? I hope that helps. And the reason I say that, because I'm very OCD and everything has to be 100%, and I'm learning to accept 95. Still till today, I'm trying to learn to accept 95.
With that said, I actually have a question. So how did you deal with failure, like during dental school and residency?
Failure is going to happen. It's inevitable. Like if you just think of failure as a challenge, as okay, somebody's challenging me right now, and I'm gonna kick its butt. And there's no other way to describe it. This is a challenge, and it's on me to accept the challenge, and I'm gonna defeat it, because you need to have the mindset is I'm gonna win it all, and if I fail, it's I learned a lesson, and I'm gonna take notes from the lesson that I learned that caused the failure. I'm gonna use it against that failure again for me to succeed. Always look at the bright side of things. So when something happens bad, look at the bright side of it. As in, okay, I failed this because there was a lesson that I needed to learn. Write that lesson down, make a good note about it, and don't do it anymore. it's easier to learn from somebody else's mistake. Like, this is another advice. Try to learn from other people. Open your ears, open your mind, listen, and listen and listen. And your brain is like a parachute. It only works if it's open.
Thank you. That was very okay. So someone was asking, what was the most challenging aspect of your dental school experience?
The most challenging aspect is being poor. Well, not poor, the debt. Whenever you get out of school, you have this debt. And then you're like, okay, I gotta pay for this. How do I start? But it'll all work out. Y'all will succeed. Y'all be good. Just the hardest part is whenever I get out and I looked at that number, and I was like, oh my God, what have I done?
Okay, thank you, Dr. Almasri. I actually have another question for you. Can you describe how you felt like when you had your first patient?
Oh, absolutely. I remember that day. So I walked into the operatory, and my patient was like uncontrolled diabetic and had the worst breath in the whole world. And I walked in and I was like, what was I like? I think 19. I was 19 whenever I had my first patient. And I walked in and I smelled that smell. I walked out and I looked at my buddy. I said, dude, I can't do this. And I'm like holding my breath and I'm walking. I was like, I don't know why I chose dentistry. I should have been a cardiologist. then I just like thought about it for a minute. I literally stepped out of the operatory because I just couldn't breathe anymore. And then one of my friends, she came to me. She goes, "Oh, here's some of my perfume. Put it on your mask." She sprayed it. I just walked back in, and all I could smell is perfume. And I got through the first patient. It was really tough. It was really, really tough because you're looking at it, and what are you thinking? Like bad breath, periodontal disease, diabetes, bleeding gums, and that's one of my first patients. Like gums were bleeding, plaque everywhere. And I said to myself, why did I do this again? And then always don't look at the small obstacles because, as I said, those are tiny little things that you're going to get over. Just look at the big picture. Look, you're a part of the big thing. And small things are going to get in your way. So don't let it hold you back. When you get that patient, another one, I remember the first time I went into the anatomy lab. And we had to pull out the dead bodies from the tubs that had them in formaldehyde. And we had to put them on the table and start dissecting. That was a challenge. That was a huge challenge. Never touched, a cadaver. So, now for me to grab it and lift it and put it on a table, and we rotate it. And the girls were lucky in my school because girls didn't have to do it. It was the boys who volunteered to carry cadavers, put them on the table. So they never didn't volunteer. Actually, we did rotation because if they volunteered, I would have not volunteered. But now I do cadaver courses. It's not ironic. I'll go teach doctors to do implants on cadavers. So, and I look at that and I was like, oh, okay, what's it doing? And we just work on it and it's perfectly fine. So that's just one of those things that I can think of too. It was tough as a dental student.
Thank you, Dr. Almasri. So that is actually all the time that we have today for questions. And we just want to thank you again for making your time in the schedule for us and for this presentation. And thank you to everyone who joined us today. Just before we end the session today, the link for the quiz will be posted in our group meet. And yeah, make sure you guys follow Dr. Almasri on his Instagram right here. And tune into our next session. Thank you again, Doctor, for taking the time.
You're welcome. Absolutely. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you, Dr.